invited in by Janelle, who unfortunately is away sick today. So she invited me to come in and talk about driving, especially in regards to the upper limbs. So looking at ways to overcome deficits in the arms to be able to get back that independent task of driving. So feel free to ask questions as we go along. It makes it a bit more interactive. I may jump forward and backwards. I tend to do that as I talk. I get on a bit of a tangent and go across. So bring me back if it's not meeting your needs. As you know, most of you would be drivers, I would assume, being in Adelaide. Driving's a very well recognised source of enjoyment. It gives us independence for going out and doing the shopping, going to medical appointments, getting into the burns unit or hands unit or whatever it might be, but it's also that sense of freedom. So many people see driving as a role of their life, not just a way of doing something. It's actually a big part of who they are. In most cases, efforts are made to protect and maintain drivers' licences. However, we have to put this right out at the start. We need to take into consideration safety of both the driver and the environment themselves. So, although we do absolutely everything to try and keep the person driving and keep that sense of independence, put it right out there, we are looking at the whole picture as well. Okay? So everything that we're talking about today is about maintaining the licence or regaining a licence, but it's about safety as well. Symptoms for upper limb issues, depending on what it can be vary greatly. So it can be restricted movements, no movements, amputations, speed of movement, response time, muscular shortening or rigidity, fatigue, pain, medications. So pain medications or other medications, especially if it's a depression medication, can slow down reaction speeds, sensory changes and depression. That comes along with losing your independence or losing part of your function. So we look at all of those areas. As we're talking about upper limb issues, it really impacts on steering. I think that's pretty straightforward, that if we've got an upper limb issue, the first thing we think about is steering. The government guidelines suggest that we need two hands on the steering wheel, and that we need to be able to have a grip of the steering wheel. Now that grip of the steering wheel isn't well defined. The old guidelines used to be well defined, but with OTs and so forth and technology that's come along, the grip terminology has actually changed. So it used to be that you had to have an OK signal around the steering wheel on at least one hand. But that's actually changed now, because the promotion of driving means that we should, the sound way of driving, we shouldn't have our thumbs on the inside of the steering wheel for fatigue reasons, but also in case of an emergency, you don't actually get that thumb injured if the steering wheel changes directions on you suddenly. So we actually promote for safety to have the thumbs on the outside of the steering wheel. So learner drivers should be, if it's a good driving instructor, should be taught to actually have their thumbs on top of the steering wheel. So a grip of the steering wheel now is not letting it slide through your hands. Okay. But the other things that we need to think about when we're thinking about an upper limb issue is not just steering, but all of these other secondary controls. So your indicator, turning the key on, so actually starting the engine, your horn, windscreen wipers, high beam, gear lever, actually getting it into gear, whether it's an automatic or actually changing gear for a manual. Putting on the handbrake, actually pressing that button in to be able to pull the handbrake up and down, depending on what kind of handbrake it is. Electronic handbrakes make life a whole lot easier now. Other secondary controls, like especially heading into summer now, air conditioning or the radio, opening the car door. How do you actually open the car door with one hand, or if you've had an injury to both hands, how do you open the car door? Shutting the car door once you're in. So maybe it's an injury to the right hand, how do you actually shut the door once you're in? Seat belts, loading the car with items, whether it's children or shopping. and then that concentration as well if you're on pain medications or you're in significant pain and it's distracting you from the road. So it's more than just steering when we're thinking about upper limbs. The next question is raised with the Department of Transport, and this is where it gets a little bit grey. Short term versus long term. If it's long term, we can actually look at modifying the licence, putting a restriction on the licence that they actually need something to compensate for their injuries. If it's a short term and they've got a period of time that they're going to hopefully make a recovery, what do we do about driving then? In the not so distant past, it was you don't drive over those periods. Other medical staff suggest that it shouldn't be a problem, just go out and drive with their arm in a sling. There's lots of people driving with arms in slings, and I'll talk about that in a bit more detail in a minute. But this is the official response from the Department of Transport as it stands earlier this week. Where a condition is temporary, there is no requirement to report to the Department of Transport. The driving should be avoided or restricted, dependent on the nature of the condition or the ability of the individual to drive safely. If there is an option to allow safe driving, then I see no reason, and this is from Jean Phillips, no reason why that an option cannot be employed. Obviously there needs to be some common sense approach with road safety being the paramount consideration. So that, to me, my interpretation, and actually ringing her up and getting an interpretation, means that if we actually look at safety and look at maybe a modification or an adaptation to the car, maybe people can get back to driving straight after their incident, as long as we look at it, and as long as they can drive the car safely. So the role of the medical team, which is here and everybody in this room, conducts assessments to evaluate the likely driving safety. You don't need to determine it if you don't think you can, but you're looking at those warning signs. If you think about yourself putting on the indicator, do you think they'll be able to put the indicator, and reaching through the steering wheel is not appropriate with the left hand, for example. So actually finding out what side the indicator is actually on can make driving safe or not safe. Monitor the capacities, the confidence and the risk, and compare that to the medical guidelines. So the medical guidelines that we're referring to as the Ausroads 2012 medical guidelines, and they've got the guidelines in there for musculoskeletal disorders, and it looks like this book here, but you can get a PDF version online. Okay, if you want to have a look at that, it's here if you want to at the end of it, or you can pass it around now if you're not familiar with it. We should contact the Department of Planning, Transport or Infrastructure, Department of Transport, to inform of the condition if a long-term issue is there that impacts on standard driving procedures. They need to know if it's a long-term event that is going to have a potential impact on driving.
So who's we?
The we, right. In South Australia, there is, lost the word, a duty of care by all health professionals, but there is, not compulsory, but compulsory, reporting by doctors, physios, and eye specialists, optometrists or ophthalmologists, if they believe that driving is impacted. Most people refer back to the medical practitioner for that.
And is it an expectation first that the patient does it?
Right, yeah, that's a good point too. So in regards to driving, if the patient continues to drive, so they've got both avenues covered here in South Australia. There's reporting by medical staff, but there's also, if you don't report, if the client, the patient, doesn't report a medical issue that has the potential to impact on driving, they can be held liable. And there's a fine of, I think it's closer to $800 now, if they have an accident which is caused by their injury and it hasn't been reported to the Department of Transport, or they've been advised that they can drive safely.
So should we advise patients to report it as well as report them?
Yes, yeah, we should advise patients to do it, but there is a mandatory reporting, that's the word I was looking for, mandatory reporting by medical staff, but also physiotherapists as well are in that act as well. Does that answer the question? Does that make sense to everybody? Now, if you're not sure, there's two avenues to actually go about figuring out if somebody is able to drive safely or appropriately. There is the Department of Transport test, which is a drive around a set course. It takes about 15 to 20 minutes, and you drive through a stop sign, a giveaway sign, a school zone. Usually have to change lanes, and it's around a set course that takes in, and a roundabout, and it takes in those main scenarios, and that's a medical assessment for the Department of Transport. Like I said, it takes about 15 to 20 minutes, and they're making sure that everybody is at a set standard. The occupational therapy assessment is different to that. What we do is we analyse the medical condition, so in this case an upper limb issue, and we look at how that impacts on driving. So it's normally the first step, or if they've had troubles passing the Department of Transport test. And what we do is we set up for the future. So we're analysing what the deficit is in the arm, how that actually impacts on all of those things that we talked about earlier, steering, indicators, handbrake, getting in and out of the car, and then plan a way forward from there. And it may involve a Department of Transport test at the end, depending on what the condition is and the long-term nature of that. They don't need a Department of Transport test if it's short-term in nature. So just to quickly identify my qualifications, to become a driver trained OT, you actually have to be have at least 2 years of experience and then do a postgraduate course to be able to learn the skills to look out for to become a driver trained OT. Okay, so it's a postgraduate course which I think they're running at UniSA. It takes about 6 months to do if you do it here at the moment, or there's a 2-week massively intensive course in Sydney or Melbourne. The role in South Australia with that mandatory reporting is that we guide the medical practitioners in regards to that medical safety and fitness to be able to drive. So we liaise heavily backwards and forwards with the medical practitioner to be able to look at that fitness to drive. In other states, occupational therapists can report directly to the Departments of Transport or the RTA or whatever it's called in those states. But here in South Australia, we need to actually get that tick of approval from the medical practitioner before any of those things are taken into account by the Department of Transport. So the locations that do occupational therapy driving assessments are Griffiths Rehab Hospital, so that's a fee for service down there, parts of it. Birru do assessments, but you have to be a client of Birru. Same with Hampstead. You have to be a client of Hampstead at the time or within 3 months. Stroke or spinal are the main assessments that they do there. Repat Hospital has a general referring service, so you can refer to them. I know that at the moment you can't get to see the doctor until about November, and then there's another couple of months wait to see the OT after that. So they have a doctor's review first, and that doctor then takes over those medical responsibilities.
What's the fee for that one through Repat?
Through Repat, it's $90. That's it, just for the cost for the driving instructor at the moment. But yeah, the rest of it's covered by government. And then you've got the private providers, which is me or other ones that are out there as well. Okay, so the OT driving assessment, just to refresh exactly what that is, thorough interview process where we actually get to know what the issue is, how it impacts on their daily life, and then relate that to driving. We actually find out where they want to drive. It's no good assessing somebody out on a freeway or through school zones or whatever else it is if they live in Barmera or a little country town somewhere, or maybe it's Betty who just needs to get to church on Sunday. I don't know what it is, but whatever it is, we tailor the assessment for their needs and then advise appropriately on that, and we may need to restrict their licence to whatever that is for that period of time. Our assessments are conducted in a dual control car, and we push those boundaries to see where the braking point is, and then we're there for safety if there is an issue with a brake on the driver's side of the car, on the passenger side of the car, I should say. We do the on-road assessment over a longer period, so we actually start to look for fatigue, we look for pain control, we look for pain management. How do they overcome pain? How do they overcome any concentration issues? And then try and figure out ways to help them with that. And we offer a counselling and advice service as part of all of that thorough assessment, where the Department of Transport test is get in the car, drive your own car around a set course, done, pass or fail. Okay? They may give you some advice on where you failed, but that's it. And they say, go and get some lessons with a driving instructor. And that's it. So you're on your own. So the thorough assessment process is really there, all-encompassing, holistic, looking at a way of getting them back to driving as safe as possible. Some of the restrictions that might come on a licence are hours of driving. Driving in certain conditions of the day, so avoiding peak hour 8 till 10 o'clock in the morning, for example, or 7 till 10 o'clock in the morning, and avoiding 2:30 in the afternoon till 7 o'clock at night, because the traffic conditions are so much more significant. It might be how far they can drive in regards to pain or tolerance. It may be regular medical reviews, making sure that there's no further deterioration, whatever the condition might be. Or medical reviews for improvement as well, and looking to get off that piece of equipment or whatever we've recommended. And then the actual restriction of using a piece of equipment. Okay. So, some of the equipment that could be used for upper limbs, and these are some of the things that you might want to have in the back of your mind. You don't need to necessarily give over the information of what they need, but you might have these in the back of your mind to see if it's appropriate for a further referral. And that might be spinner knobs, and we'll actually explore some of the different types of spinner knobs a little bit later. Indicator extensions, so if their injury's on the right hand side and their indicator's on the right. How do we actually put the indicator on? And it could be through an extension. It could be electronic secondary controls. Okay, so that might be that with a remote control, either in the spinner knob or away from the spinner knob, to put on those secondary controls like your horn or your windscreen wipers and so forth. Seatbelt extension, so actually reaching around the body might cause significant pain, or reaching around this way may cause significant pain, or maybe there's restrictions through the torso as well to stop that. We can look at seatbelt extensions either way. Handlebars for being able to get in and out of the car. Key turners. Pillows. Pillows are excellent for supporting the affected limb, so there's not the vibration of going over bumps and so forth, so we can actually support that limb so they're in a lot more comfort and we're able to drive further. We can look at slings, types of slings where their arm is positioned while they're driving. Steering wheel covers to actually make the grip wider. Prosthetic amputations to be able to assist with grip or be able to put on an indicator, for example. Power steering enhancement, and then the mirrors as well. So the other thing to consider with an upper limb injury is that it can radiate or be part of the shoulder as well, and actually turning to check your blind spot either way can be quite restricting. So we need to be able to make sure that they can actually see the lane next to them to be able to change lanes. Alright, so here we go with some nice pictures to show you what we've been talking about. Okay, so this gentleman had an amputation of his thumb, actually had the amputation of his hand, and the thumb wasn't able to be saved. And this is one of the prosthetics made by your team here to be able to help him with the grip. But what we've been able to use that prosthetic for is to be able to stabilise the wheel. He can't steer with it. He can't actively steer because there's not enough grip in it, and he actually doesn't have enough flexion of the fingers to be able to grip the steering wheel into a cylindrical grip. But it's got enough grip to be able to stabilise it to put his indicator on. So he can actually let go of the spinner knob to put his indicator on and then use the spinner knob to be able to steer. What we're doing is we're monitoring this man. He hasn't had a restriction on his licence because there's continual improvement in that grip. So he should be able to get to a point where he can grip against the palm of his hand to be able to get away with not having that spinner knob and actually go back to two-hand steering. Okay? That's what we're looking for. Not only are we looking at cars, but we're looking at upper limb for truck driving or machinery or forklifts or whatever it might be that they need to drive. So this man had a left upper limb issue, and we look at loading and unloading. We look at indicators are on the left in trucks and all of the multiple controls that you have to actually do with the left hand to be able to drive a truck. Most truck drivers steer one-handed with the one hand, a little bit of two hands to be able to help out here and there, but most of the steering comes right-handed only, so that's something to consider if it's a right-hand injury, because their left hand is very busy on all the other controls. This is a picture of a spinner knob. Is this the play one? I think it is. Oh, that's handy, isn't it? Sorry about that. Why did it turn sideways?
Camera on the sideways.
Yeah, but anyway, I thought I'd fix that. Anyhow, if you can all turn your head sideways, it didn't do that one on my computer at home. He's actually got the controls in here, so he's actually using a spinner knob very close to this one here, and he's putting the indicators on with his thumb up here on the top, and he's also got headlights, high beam, so if he presses it it'll flash, if he holds it down it'll come on, and the same with the windscreen wipers. If he presses it once it'll be intermittent, if he presses it twice it'll be on, press it again and it turns off. It doesn't have high speed. And the horn on there, so he's holding it that way, which is a nice neutral grip for him. There's other ones as well which are like this one, with it's very similar. All the buttons are spread out all over the controller, but this one is held that way on the steering wheel. And as you can see, I'm not a big fan of this one for the way that the hand is positioned over a long term. Hope the other videos don't turn sideways. Sorry about your neck issues if you've got any. Let's find out with the next one. So that's it there in action. So this is an indicator extension for the left. So this lady here couldn't actually hold it up at around the 9 o'clock, 10 o'clock mark because of a shoulder issue that when we're driving along a straight road, there's the camber of the road that drifts off to the left. So she had to constantly push up against that camber of the road when you're using the left. So the bicep head can get quite painful, holding it slightly in extension against the force of the road, forcing you down into the gutter. So holding it down lower, where you can push your elbow into your side, can make a huge difference. So having the indicator extended right down there can make a big difference to be able to put that on and off. What she does is she doesn't drive in the rain. That was her way. Or if she does, she pulls over, put the windscreen wipers on, and then pulls out again. This is another version for the right-hand side, putting it nice and close to the indicator.
Who does these modifications?
Good question. We do. But there's also Les Brazier Engineering and Craig Goodall Engineering, or there's Occupational Therapy. So there's different people out there that can do these things for the drivers.
And when people go to the Department of Transport, get that assessment, can they take their own car with these mods on?
Department of Transport, you do the assessment in your own car. They actually have a modified car with a few bits and pieces on it, like they've got a spinner knob in their boot. They actually don't have an indicator extension, so you have to reach around with an interesting grip to try and reach the indicator, or if it's on the wrong side, then.
So would that change insurance policies?
Yeah, it does. Yeah, if it's a long-term thing, we suggest that they present their OT report or whichever report that they've got and their Department of Transport test to their insurance company to show that they're capable of driving this modified car, and then presenting, well, Williams OT produced a piece of paper to say that these have been installed, and then they go to the Department of Transport to have the engineering ticked off. So all cars need to be roadworthy, and they need to take it back to the Department of Transport, and they make sure that this is roadworthy, that it's not going to fall off, and the spinner knob's a roadworthy one. So you can get a $2, $3 spinner knob over the internet through eBay, for example, but it won't actually pass the Department of Transport level of roadworthiness. Alright, then you've got this as well, okay? Please don't spin around. This is the other end of the story, okay? So this man he's the only man in we think he's the only man in Australia driving with cerebral palsy with such significant levels of cerebral palsy. And he's driving by remote control steering here, so joystick steering, okay? His indicators are over here. We've just put cruise control, extra buttons in on that little device over there, and he's driving without touching the steering wheel whatsoever. If we've got sound, lower limb control, we can actually put a steering wheel down where the clutch would be. So you would actually steer with your left foot with a steering wheel down there, and your right foot would be for the accelerator and the brake. So you can have complete amputations of the arms and still drive. I've been watching the Paralympics and looking at them all in the pool and going, I wonder how they drive, and what modifications they're using to be able to drive. So you know, they're all options out there. So what to remember is that the driving is a complex task. It's not just two hands on the steering wheel. There's a lot more to it. But it gives us autonomy and a sense of identity. It's the doctor's obligation to inform, well, it's actually the physios as well and eye specialists, but it mainly falls onto the doctors, to inform the Department of Transport if the condition impairs on the ability to drive, especially over the long term. If it needs to be a restriction on the licence, or even if they're cleared to drive, you need to notify the Department of Transport from a medical practitioner point of view. If the condition is short term, the driver is to be restricted from driving as one option, or a safe alternative needs to be found. We can do that. We've actually got a hire service, and we've been able to do that with spinner knobs and indicator extensions, and installing those over a short period of time. Like the other man with that red spinner knob, the short period of time is now extended out to 9 months. I think it's actually beyond that now. I think we're coming up to 12 months of him being able to get back to driving, but we haven't had to restrict his licence because the ultimate goal is to still be able to drive without modification.
So how much would that cost? Because obviously our patient's public.
Yeah.
So say there was someone who really wanted to drive that we say you shouldn't.
Yep.
So to have an appointment with you, get a spinner knob,
Yep.
how much would that cost?
A full assessment is $700. So that's the initial assessment. It's the liaising. This is us. Everyone has their own price way of doing it. Initial assessment, report writing, on-road assessment, driving instructor for that on-road assessment for safety is all included in that $700. Spinner knobs, depending on what they need, is what they need. That's the full assessment. However, we can actually tailor that assessment if we get sound medical advice to start off with. No other cognitive issues, no other physical issues. We're looking, we know that the hand can't be used in driving at the moment. We will check that, but then just do the on-road assessment and look at going forward rather than doing an initial assessment, the full initial assessment. So we can actually tailor that down depending on what kind of referral we get. Assessments can be performed by the Department of Transport, and I talked about that set course route. But OTs also undertake driving assessments, and they're much more thorough, and we look at what the rehabilitation may be able to be. And we will guide the medical practitioners for that ongoing advice, for that medical fitness. Driving can be graded and modified if appropriate to increase safety for both over the short term but the long term as well, and guide on that medical